Your Excellencies, for the pledges you have made today in this regard. With your word, I'm assured that we will tighten our mapping, enhance our prevention services, and reverse the increasing incidence of breast, cervical, esophageal, prostate, or leukemia cancers that are consuming our people. As COVID-19 has shown us, we have the capacity to prevent, mitigate, and cope with challenges. Fellow Kenyans, turning to our COVID-19 situation, and as discussed with the governors, we have noticed over the last couple of days, in the course of this month, that except for a couple of days, we have been on a positivity rate of below 5%. The World Health Organization proposes that when you can run a below 5% positivity rate for over 14 days, heading for 21 days, then as a nation, you have begun to flatten the curve. However, let me caution that even as we do so, events elsewhere across the globe indicate a new COVID-19 cases. If you look at what is happening in the UK, what's happening in Spain, in Italy, and Germany, and France, and other countries in Europe, then we have no choice but to be cautious for that second wave that is always a possibility. But today, 130 persons tested positive from a sample size of 3,874, which means that once again, we had a positivity rate that is below 5% at about 3.4%. And so far in this country, 37,000 people, 37,348 are the number of confirmed cases, with cumulative tests standing now at over 500,000 at 523,998. And from the cases today, they are all Kenyans, except for 7 who are foreigners. And in terms of gender, 89 persons are male, while the youngest person was a 3-year-old child, while the oldest is 90 years old. In terms of county distributions, the highlights of that which you'll get in the press release is Nairobi had 35 persons, Kiambu 23, Kisumu 19, Mombasa 14, Uasin Gishu 8, Kericho 6, Kisii 5, Busia 5, Kilifi 5, Bomet 2, Narok 2, Perus 1, Siaya 1, and Kajiado 1, and Taka 1. In terms of the recovery rates, we have 106 persons who have recovered from the disease. 81 have been discharged from various hospitals, and 25 from the home-based care program. The total recoveries to date start at 24,253. And again, appreciate work being done to them and for Kenyans at large by our healthcare workers. Unfortunately, we also lost 5 patients who have those who have passed on to 664. Our sincere condolences goes to the families and friends of those who have lost their loved ones. Bwana, kama nilivyosema, leo tulikuwa na unavyoona, tulikuwa na governors kutoka counties mbalimbali, na tulikuwa tunazungumza mambo ya afya, lakini sana sana mambo ya kansa ambayo imeendelea sana katika nchi yetu ya Kenya. Katika hii hospitali tumekuja kuangalia na governors wamekuja kujionea wenyewe. Sana sana magovernors zile counties ambazo zina mahospitali ya regional hospitals ambazo ndio tunataka kufanya hospitals ndio tuweze kutumia zile consumables tunatoa hapa katika hii hospitali na kupeleka hizo regional mahospitali tunaweza kusaidia watu wasije kuja mpaka Nairobi ndio kutibiwa, lakini wanaweza hata kutembelea mahospitali au mengine kutoka hospitali za upande wa Kisumu, Mombasa, Garissa, Nyeri, Nakuru. Hapo mbeleni watu wanatembea safari ndefu sana kufikia sana katika hii mambo ya kansa. Kwa hivyo mimi nakushukuru governors wote, sana wa governors ambao fika hapa leo ndio tuweze kufanya kazi na tuweze kusaidia wa Kenya. Kansa imekuwa ni hasara kubwa sana kwa watu wengi sana, kupoteza maisha ya watu wengi sana, na hiyo sababu yote ni kwa sababu hii kansa inapatikana wakati imeendelea sana kwa mwili, wakati imeenea sana ndani ya patikana aga dunia. Tunataka katika ile mambo tunaanza sasa ni tuweze kupima mtu mbeleni sana. Tunajua kabla hii kansa haijafika stage 3 ama vile tu ikianza tunaipata, na ikipatikana hapo basi wale watu ambao wanaaga dunia watakuwa wachache sana. Na ndio tumeshukuru hata rais wetu kwa sababu walipokuwa hapa ndio amesema ni lazima tufanye hii kazi na ni lazima tununue ile mashini ambazo ni lazima ziwe hapa hali ya kwenda India na kwingineko kutafuta cure ya cancer. Kwa hivyo nataka kusimamia hapo. I want to give you a chance to ask questions, but before I do so, I also want to give the chair of the Committee of Health in the Council of Governors, Governor Dr. Kuti, to also say one or two things, and then we take one or two questions. Thank you.
Thank you very much, Cabinet Secretary. As governors of manning major hospitals in the regions, to come and see for ourselves a very advanced facility for treatment of cancer. We know very well how many of our citizens have been seeking cancer treatment, whether frustration because of lack of facilities, or those who can afford, then flying out to mainly India, South Africa, and other countries, incurring a lot of cost because they have to be accompanied by individuals who look after them. They have to hire places to stay in hotels. It really brings a lot of economic suffering, not just to that family, but even the neighbors, all relatives. And it has a major economic impact. And the common thing to find is a case of cancer. So coming here today and seeing a state-of-art facility that actually will enable people not to travel. There will be no reason for any Kenyan to travel out because of the facility that is being developed and that is already developed. So that anything you need in India or anywhere is now available in the facility. It's a major reassurance, it's a big announcement to Kenyans. And we really, as governors and leaders in the region, we want to thank His Excellency the President, yourself, and the management of this facility for having the dream to bring Kenyan suffering to a minimum, to minimize that suffering. We have discussed, and we want to, on behalf of my colleagues, to commit ourselves to ensure that this facility is not overwhelmed. And the only way to make sure it is not overwhelmed is to create regional facilities that then absorb the lower level of diagnosis, and also this facility will be producing isotopes, and those isotopes will then be sent to these regional facilities, our facilities that is, and we will be then able to diagnose cancer very early and be able to treat them at that level. Only those that are more advanced and requiring more specialized care could come. We have agreed in this meeting to partner and make sure that every Kenyan, wherever they are, will have the best of early diagnosis, because cancer has 4 stages. Going to come to the counties. Now cancer will be able to be diagnosed at stage 1 and stage 2, which are the stages that are easily treatable. And that is why 70 to 80% of cases in Europe and America, people get cured of cancer. It's because of the early diagnosis of stage 1 and stage 2. And this facility, therefore, and the referral facilities that will receive the isotopes will be now able to diagnose cancer at those stage 1 and stage 2, which therefore the survival rate for Kenyans will be much better. We want to really join His Excellency the President, yourself, and the management of this facility to start this new journey, which is already started, to make sure the sufferings of Kenyans because of cancer will be a thing of the past. We have also discussed the urgency for training, so that it is not only the facilities which will be put here and in the counties, but also it is accompanied by a rigorous training component, so that we have competent Kenyans managing those equipments here and in the counties, so that the synergy they bring because of that competencies and the ability to use those equipments then will be able to be beneficial to Kenyans. We really say thank you, and we are also grateful about the fact that now we are flattening the curve. And I want to echo what you have said, that let us not celebrate because the curve is flattening. Because once we start removing the masks, once we stop washing hands, once we start not observing social distancing, then those figures that are going down will start going up again, and we will be in square one, the way Europe is now going through a second wave. So let us remain vigilant as Kenyans, and I really appreciate the effort Kenyans themselves have put to make sure that we observe the guidelines of Ministry of Health, and we have been able, the overcoming of this disease is not because of the leaders who are in frontier. It is because Kenyans observed, and most of the time they observe more than us, and I really appreciate them. Thank you very much.
Thank you very much. At this point, I would like to, we can take 1 or 2 questions or clarifications that you might need, and call it a day.
My name is Mutanu Banadine from the Daily Nation. I have 2 questions. How much will it cost to be treated here at this center and at the county facilities? And then the second question, apart from provision of the isotopes to the counties, what else will make people not to come here at KU to be treated? How many centers do we have? How many centers do we have in the counties which can do cancer treatment? Thank you.
My name is Chris Omlando, NTV. I have a question. A PPRA preliminary report says that there are irregularities in procurement at KEMSA, and top MOH officials were allegedly involved. What's your take as a CS?
Next.
Yes, good evening. My name is Ben Kirui from Citizen TV. As we prepare for gradual reopening of schools, how many learning institutions had been set aside to be used as isolation centers, the number of primary schools, the number of secondary schools, and tertiary institutions? Secondly, how is the Ministry of Health planning to help the Ministry of Education in cleaning up to make the institutions safe for learning? And lastly, or finally, plans, if any, by your ministry as part of the ongoing measures to ensure learners are safe. Thank you.
The last one.
Good afternoon, Waziri. My name is Emmanuel To from KTN News. You've counted the numbers of days that are required in order for a curve to be flattened. So counting those days as the ministry, have we flattened it, or when are we flattening the curve? Thank you.
Thank you very much. Let me start with the costs, and maybe I'll give the chair an opportunity to respond to that. But let me just talk about generally the cost of healthcare, because I think the question that Mutanu asked is so important. And it is true that one of the reasons why, or some of the reasons why people travel to India and elsewhere to deal with, to get treatment is the cost of healthcare. And as a ministry, we are determined to bring down the cost of healthcare. We are engaging doctors in our ministry, and we are urging the council to look at the cost of that is charged by a patient by a doctor. We are engaging the financiers of machinery and equipment for hospitals, so that instead of giving them very short-term amortizing periods, but to give them longer term to pay for the equipment. We are looking at the collective, at the entire collective system that governs issues that are going to inform on the issue of healthcare cost. But remember that even the isotopes that were being used, for example, at Aga Khan and elsewhere, for cancer treatment have to be imported. And these are very difficult things to do. So the fact that we are now going to make some of those consumables available locally also means that we should be able to bring the cost of healthcare down. And finally, the fact that this equipment that we are putting here does not exist in the Central and East and Central African region, which tells you then that we are going to get a lot of people coming from across the borders. Medical tourism is going to grow. So instead of charging and breaking even on the basis of very few people, it means that we can operate a volume-based costing system rather than skim the cream costing system of healthcare. So I am convinced that they will come down. On the issue of the equipment that they need to buy, we are looking at a whole range of equipment, but specifically because of the isotopes that they are producing here, we will be able to invest in PET scans across the regional hospitals. As you know, currently, I think it's only, how many hospitals?
Yes, one.
It's just one. Yeah, one, and Aga Khan, that's it. So if we can, because what is going to happen is that a lot of people are going to come to this hospital, and that is what Governor Kuti was explaining. Because this is not available, this service is not available in the region, it means that a lot of people would come here for treatment because of the use of the equipment, particularly the PET scans. So what we are going to do is that the government is going to work closely with the county governments, and the president himself has said that we are going to work with the regional hospitals on a 50-50 basis, so that the county governments working as regions are going to have their PET scans and other equipment that is necessary as they will determine, and as our medical engineers will determine, and the cost of that will be shared between the county governments and the national government. This is again in an attempt to ensure that we bring down the cost of the cost that we are going to be charging. Our idea is to rate our costs to be equal to or less than Thailand and India. On the issue of opening of schools, we are in fact working very closely with the Ministry of Health. With the Ministry of Health is working very closely with the Ministry of Education to see that certain protocols are put in place before the reopening of schools. And let's also understand that the schools are not opening for term work. They are opening, especially the younger kids, so that they can also get used to being in school. They have been out of school for a long time. And in a way, it's also for us to see, what we need to do as we move into next year, so that if there are challenges that we are going to face, let's face them now. If we are going to have any measures that we need to take, we can put them in place. But I can tell you that the Ministry of Education is going to observe very, very strict guidelines, and they are doing so, and we are working very, very, very closely with them. On the issue of the curve, I think that what I'm going to do is after the chair has spoken about the cost that the cost of healthcare in this facility and the expectation going forward, I'm also going to ask Dr. Amoth to speak to the issue of WHO and the rules regarding the flattening of the curve. Chair, please.
Thank you, CS. I'll just talk about the cost of the expected cost of PET scan. I'll just say that in the private sector, right now it's costing about 75,000 shillings. But as the CS has said, we are going to use the economies of scale to bring this cost to less than 50% of what is being charged now in the private sector. And this will be less than is being charged in India and other countries. Thank you.
Dr. Amoth.
Thank you, Waziri. Just to add to what Waziri had said about the schools is, of course, the development of the guidelines and protocols that we have developed jointly. We are also going to support the Ministry of Education in terms of fumigation and disinfection of the learning institutions in readiness for first opening. Of course, we have also developed jointly the specifications for masks, because some of the learners are young and the ordinary mask may not be able to fit them. And of course, we continue to do capacity building on public health social measures and infection prevention control. And we'll continue to do joint surveillance in the places of learning to ensure that if there are any cases that will arise, we'll be able to quickly pick them and deal with them appropriately. There are other questions regarding the isolation centers. Yes, we can be able to provide the figures. I may not be able to have it offered, but remember, since we started implementing home-based isolation care, there are very, very few people in institutional care for either isolation or quarantine. In fact, the Ministry of Education has given us instruction that we vacate their facilities in preparation for opening of the facilities. How do we make learners safe? Of course, by adhering to the protocols and guidelines that we have developed jointly, including infection prevention control measures and the public health and social measures like hand washing, sanitization, and full masking, especially when the learners are in public spaces and also in the classrooms. And of paramount importance, of course, is shielding the learners with comorbidities. Those who have cardiac diseases, those who have kidney diseases, the asthmas of this world, and of course, sickle cell disease. So it's paramount that those with comorbidities are shielded appropriately by ensuring that for them they fully mask, and we monitor them closely in case any of them develop COVID-19 and appropriate measures are taken. When we talk of flattening the curve, the WHO regulation is that we have a positivity rate of 5% or less over a period of 14 days. And as Honorable Cabinet Secretary has indicated, if you look at the past 21 days or so, our average has been less than 5%, despite a few blips like 1 or 2 days ago when you had more than 6.8%. But we don't take that alone into consideration. We also look at the number of patients who are admitted for institutional care. And as of today, we have just about 484 patients in all health facilities with COVID-19 disease, from a high of more than 1,200 cases 1 or 2 months ago. We also look at the number of cases who are on critical care. As of today, we only have 14 people in ICU under critical care, 4 of them on ventilatory support, the remaining 10% on supplemental oxygen. So that number has also decreased significantly. And of course, of paramount importance is that we are not noticing excess mortality at the community level. And also our clinical surveillance at the facility level, which looks at SARS, severe acute respiratory infections, has not generated any evidence to indicate that the cases that we are seeing, we are not picking other cases from the community. So we take that into consideration on top of the positivity level. And from the data that we have from clinical surveillance, the serosurveillance that was done by Kimberley Wellcome Trust, and from our count, we are past our inflection point. But as Waziri has said, we should not throw caution to the wind because we can easily reverse in terms of the progress that we have made, as has been witnessed in the continental Europe, where now there's a resurgence of the cases and they are now reimposing the strict containment measures. Thank you.
Thank you very much. Good.